I'm Patricia Rockman with the Center for Mindfulness Studies, and I'm the co-founder and Director of Education and Clinical Services. And I'm here today to speak to Dr. Zindel Segal, one of the developers of Mindfulness-Based Cognitive Therapy. And we wanted to create this video for you because we have an upcoming training intensive in Mindfulness-Based Cognitive Therapy for healthcare providers, psychologists, social workers, and any clinicians that could benefit from learning this important modality for preventing depressive relapse. So I'll just begin. Hi, Zindel, how are you today?
Hey, Pat, nice to see you again.
Nice to see you. I'm really looking forward to our training in November, and I just wanted to ask you a few questions that I think viewers could benefit from hearing the answers to. And I guess the very first one is, why take MBCT in a professional training? What will people get?
Yeah, I mean, I think it's a great question, and I think people will get a lot. This particular training is one of the stepping stones in the MBCT training pathway, and it's one of the important ones because it comes at the beginning where we start to mesh the experiential learning with some of the conceptual learning around MBCT or some of the introductory concepts. This particular TTI allows people to have the experience of both being in an MBCT group and then very quickly pivoting to delivering the core practices of MBCT under supervision, guidance, and feedback from a larger community. So formally, it's one of the important steps in learning to become an MBCT therapist. I think there are a lot of other benefits which come from taking this course online. One of them is learning how, as increasingly mental health services are being offered online, a way of doing that to connect with patients or participants, to generate energy, and to keep the focus through a virtual platform, which may be for some people the first time they've ever had to engage in delivering care that way.
So you're pointing to something that I think is important that we raise. You and I've taught together a lot, and we've taught face-to-face in retreat settings. And I know that you've been doing a lot of research around delivering this work online. And I'm curious to hear from you two things. One, what the sort of comparisons around delivering this work online versus face-to-face, the effectiveness, the differences, if there are any, and the kinds of things that people need to be able to teach this work online.
Yeah, I guess in a kind of broad brush stroke, people might say taking this online compared to doing it in a retreat or residential format is different. And different used to mean worse. But I think that before COVID and before we had to deal with the pandemic, that perception was out there. But I think since the pandemic, there has been this increasing embrace of services delivered via virtual platforms. And that's, in a sense, exactly what we're doing here. So different can also be valuable because it still allows people access and the option to participate. I think that we're definitely seeing that across the mental health sphere as more services delivered online are being seen as legitimate and also fundable. And yet different also requires a way of learning how to connect and how to stay available to people in much the same way that you would if this was face-to-face. I think the delivery of treatments online, some of our own work, the most recent study published in JAMA Psychiatry showed that online MBCT delivered to folks in a large HMO in the US really was quite effective and quite powerful in terms of reducing residual depressive symptoms. So the efficacy is there. And now what we're trying to do in this particular workshop is to both convey the elements of MBCT as well as to provide you with ways of teaching it online that may help you sharpen your ability to deliver it in just this way. And that'll be one of the, I guess, additional pieces that this training can offer you. not just the competence in MBCT, but the way of teaching it online, so that you can really feel present and able to feel like you're giving everything that you have to your participants or clients.
I know that you've been delivering some of the trainings online, as well as, I know that you developed MBCT as a modality to deliver online. And I'm just curious to hear about your experience around, some of the differences, the pros and the cons, if you have anything to say about that.
Yeah, I mean, I think for me, one of the things that I noticed in myself was attachment. And a sense that it needed to be a certain way. I love the residential trainings. I mean, with Pat, having time to go into the room where we were teaching, and then having downtime when we could go to a cabin or a room and talk about the day and sort of plan and strategize for the next day. The informal meetings with people and meals shared together, and the kind of grumbling about having to wake up early and go to sitting and practice. But that's actually not available, and to assume that that's the way in which it needs to be is, I think, a difficulty. It introduces a difficulty into our thinking. Instead, what I've seen is that this kind of training resembles somewhat more the client's experience of transitioning between moments of practice and moments of stepping away and then coming back. So this continuing shift between on-screen, off-screen, here and away, and that all of this really, when you're involved as thinking of it as a 5-day frame of practice and learning, all of it becomes held in the same container, as if we were there, as if we were at Orangeville, or as if we were at Omega, or as if we were in other places, because it's the same thing that we're both asking of our clients. And even when we're in those places themselves, there are times when we might, step away or feel like you're not sort of in workshop or TTI mind, you're in like, I'm going to have an ice cream mind, or I'm going to go for a walk, or I'm not going to come to that session because I'd rather be a truant and go swimming or something like that. All of these transitions within the 5-day frame actually are practice. And so what I've noticed is I've let go of the fact that it needs to be like Omega, and I've embraced the fact that it needs to be like right here. And inside of that, even when I step away from the screen, I'm still engaged, I'm still thinking. And I think that's the invitation that we'd want to ask and offer people right from the get-go, to practice inside that same kind of framework.
So they end up having a kind of retreat training at home, if you like.
Exactly. Yeah.
All right, great. Okay, I think this is great. So thank you so much for that.
It's a pleasure.
Yeah, and I just want to finish by saying that the Center for Mindfulness Studies has moved all of its programs online, including its professional development training programs. And this is the first time we are offering this one in this way. And we've put a lot of time and energy into the development of a learning management system. And in addition, we've been working with IT specialists to help us to be able to deliver this kind of work in an as experiential a way as possible. And just on a last note, I just want to let people know that we have a relationship with the University of Fraser Valley now, and this training intensive, the MBCT 5-day training intensive, serves as an equivalent of a graduate level course in the University of Fraser Valley Mindfulness-Based Teaching and Learning program. And in addition, we have accreditation for continuing education for many healthcare providers. So thanks so much, Zindel. And I look forward to teaching with you in the fall.
I look forward to teaching with you, and I look forward to meeting everyone later in the fall.
All right, thanks a lot.
You got it. Take care.